Good morning, everyone. How are you? How is everything? How you feel? Today we are in JOT at very nice restaurant, and my God, this bird. Yeah. Welcome to the breakfast with the dentist. I'm Dr. Samila, and today we're having cozy, informative morning. So we'll chat about all things in dentistry while we'll sip our morning coffee or tea and. Tell me, where is everyone watching from? Drop your city, please, in the chat so I will know from where people watching me. And yeah, and let's wait. Other people is joining, so let's wait. Let's give some time because today is Sunday and people just woke up and just this is like late morning show today. Usually during the week it will be 2 3 times per week and it will be earlier, but today is Sunday, so people may be also tired and working all week. They need a little bit more rest, more sleep. So drop your city in the chat. I will know who is joined today and who is watching me from which country, and tell me how you feel and what's your occupation. It will be very interesting. And let's meet each other and let's become like friends, because most of my patients, they become my friends, and also most of my followers also are my friends and my colleagues. So let's wait some people to join and we will start. Let me briefly discuss with you like what we'll have today on our menu. So we have some exciting topics today. Actually, guys, write me also. Can you hear me very well or no? Because I'm using my AirPods. So just let me know if you can hear me. Just drop some comment in the chat that you can hear me. Wake up, guys, wake up. For some people, it's today working day, not day off. Like me and my colleague, Dr. Ahmad, and me, we have patients today later on. For me, in the evening, I have some patients also as well for veneers, for consultations, and for follow-ups after veneers fixation. So let me tell briefly what we'll discuss today, what's in our menu today. So today we'll discuss the craziest new dental innovations. It's like robotic dentists, AI-powered smile design, and micro robots that clean teeth. Can you imagine? Micro robots that clean teeth. So also it will be a live question and answer session, and I'll answer on your questions and about veneers, whitening, and any dental concerns you have. So you can later ask me in the chat, and I will be very happy to answer on each of them. So also next will be fun dental myths and facts. So let's go some common misconceptions, and you will tell me you agree or you disagree, what you think about this. And of course, this is we'll discuss our new segment, which is story time with the dentist, as I promised. Real cases from my practice, what I faced during this week, and some maybe funny moments, some maybe like challenging cases. I see people start joining. Everybody is present, so I'm very happy to see you all today, and I'm very happy that you're sharing your breakfast with me. And let's make it informative and interesting and fun for each of us. See, today, actually, uh, for some people, like I know, like in Ukraine, Russian countries, it's day off. And here also they recently changed Sunday to day off. Before it was Friday. In some cities still it's Friday and Saturday they have, and also Sunday as well. Yeah, but for us sometimes we are working like 6 days per week and 1 day off. Sometimes you can choose which day off. It depends like where you work and in which company. But I'm very happy if it's your day off and you decide to spend it with me, this to share your morning coffee with me. And to enjoy this view. Actually, Gilteria has very beautiful view. So I choose today for our meeting this view, so we can enjoy not only informative informative chat, and also we can enjoy the view. Okay, let's start. Let's start from first segment, which is will be today's hot dental innovations. So technology is taking over dentistry, and let's talk about some mind-blowing new inventions that could change the way we take care of our teeth. So first, I want to discuss robotic dentists. So probably this is the future. I know someday our quality of our services, and also I believe it will help us in many things. So also it will save our time, so we can see more patients than we can. So it's good. What do you think about robotic dentists? You will tell me later. After I will give you some information about this section. So did you know that a robot just performed the first fully automated dental procedure? So one company, which is named Boston, perceptively developed a robot that placed an implant, can you imagine, implant without any human hands. So can you imagine this? Like if you prefer to visit one specific dentist, but you are abroad and you want to receive service from your dentist, so your dentist can perform this surgery without be present in this city or country. So it's very nice. What do you think about this? Would you trust a robot to do your dental work, especially implants, which is invasive procedure? So would you trust? Yes or no? Write in chat, please. I want to see like your engagement, and really your opinion matters really. So would you trust robots to make any procedure inside your mouth? So especially like dental fillings or maybe implants, because I know also in like eyelashes, like eyelashes masters, their industry, there is already robots who can put eyelashes for you. So human will make maybe in 2 hours, 3 hours this work, but robot can make in 15, 30 minutes. So same this robotic dentistry. But for sure, our health, teeth, it's not like eyelashes. So it's very complicated, and it requires more attention and more precision in the work. What do you think, guys? Would you trust or no? Yes or no? Oh, a lot of people start joining. Good morning, everyone. Happy Sunday. So, next, I want to tell you about micro robots that brush your teeth for you. So, can you imagine a robot will brush your teeth? So, you will just do nothing. You have robot, it will brush your teeth, and maybe more precisely than you can do it for yourself. So maybe in future there is no any toothbrushes, no electric brushes. We'll use robots in closest future. So imagine never needing a toothbrush again. Like there is one very nice researchers from the University of Pennsylvania. So they developed this microscopic, it's like microscopic robots that can act as a toothbrush, floss, not only toothbrush, floss, and mouthwash. Can you imagine this? It's happening all at the same time. So all the steps all together performed by these micro robots. Really impressive. So would you allow the robots to brush your teeth? Micro robots. Maybe at least you will trust for brushing your teeth. What do you think? Tell me. Would you trust or no? People just only joining. Uh, Guys, really, your engagement very important. Just write something like yes or no, so I will know like you're watching me or just joined. So for me, it's very also important to know your opinion. It really matters, really, because maybe also me and my colleague will provide some digital smile design. So it's not like conventional digital smile design; it's AI powered, and we do complementary along with consultation for our patients. This digital smile design, so you can see your smile before. So you can choose which teeth you want, which shape, color, and will it match your personality, your facial structure, and other things. So now we'll slowly go into the third section, AI in dentistry. So will computers take over? What do you think? AI now really helping dentists to diagnose cavities, plan veneers, and even predict which teeth might get cavities, not just when you see that cavity or you touching with a probe and you see it's your probe stuck, so it means probably cavity started. So cavities, not all cavities, it's like can be like deep. It can be just in initial stage, and this AI technology can predict even if you're tent in this area to get some cavity. This is impressive, really, guys. It's like mind blowing, mind blowing. So this AI can plan veneers and also diagnose cavities and can predict might you have cavities or no. So some studies show AI is more accurate than human dentists at spotting dental problems on X-rays. So also I know there is specialty pulmonology. They're doing X-rays for lungs, so they can recognize cancer, tuberculosis, and other problems with the lungs. And AI can even see something like even in breast, like for women or even sometimes females, they have gynecomastia. So there is like very serious condition, whereas you can get breast cancer. And this AI powered technology can detect on X-ray you have it or no, because sometimes like our eye like can't see this, but AI can see the things which doctor can't see. So would you trust AI to plan your smile makeover? What do you think? And tell me what you think. It will be more accurate than your choice and your dentist advice. Like, what do you think? AI more precise. Like you will trust to design for you AI program as your smile. Tell me, guys, yes or no? Because for me, it's very interesting and really, like, your opinion really matters. Because if you are interested in such things, we'll discuss it more next time. We'll go more deep in this subject. So, really, we can maybe provide it in our clinic soon if you are interested in such services and technologies. Because in our clinic, we are using latest technologies. Me and my colleague, Dr. Ahmad, we just recently went to IEDIC and we saw a lot of interesting things. We bought a lot of new equipment for you guys. And it was a lot of very nice demos and presentations. We were impressed by one device, like for broken file in root canal. This will be more interested for doctors, not for you, but I will tell you briefly about it. So if, like for example, like suddenly something happened and piece of this file, which is removing and reshaping your canal, it's broke inside the canal. I know some doctors they trying to remove by different methods, but this method more precise. It's one company, I believe it's a Korean company. So there is special device. It has some button, and you can just push inside the canal and can retrieve without any damage, without any harm this instrument. And this is just 1% what we saw from that. So we have a lot of new innovations, and really this year I like IDEC too much. Later we'll discuss about this, about IDEC, and this is really very amazing exhibition, and I'm advising and answers. Like, all right, now it's your turn. Drop any questions you have, whether about veneers, whitening, bad breath, maybe, because some people they develop bad breath. Maybe they're taking some special medications. Maybe they wear some old restorations. Um, because not always bad breath can be caused by stomach problems or tonsils problems or teeth problems. It's usually accumulation of the problem. But if you have any questions, let me know. I will advise you something, and let's discuss. Let's engage in this conversation. Let's drink our coffee. Let's take a sip of coffee, and let's wake up and let's discuss a little bit things which is bothering us or maybe interesting for us. Prepare your questions, and I will try to answer on it. Yeah, I see questions not coming from our viewers. So maybe you feel shy, don't feel shy. We are all family, and any question is appreciated and will be answered. Nobody will leave this chat without answering on it, on their question. Actually, I'm doing in English this live because most of people who is watching us English speaking. Um, but we can make next time in any other language like Ukrainian, Russian language. But most of our people who is watching, they're speaking English. Good morning, Mr. Amin. Good morning. So, okay, let me help you. What's one thing about the dentist that make you nervous? Let's talk about how to fix it. So, just write for me what's the at least one thing what about dentist what make you nervous. Just anyone, please write me something, and I will start answer on it because I don't want. I will always only talk. So we need engagement. We need interesting questions or any questions. So let's engage, guys. Okay, let me tell about my experience when I was the patient back home, and when I had this dental phobia before I met my colleague Dr. Ahmed. So now I don't afraid dentist. So I'm now I found my trusted and reliable physician. Actually, I highly recommend him. He did for me my teeth, if you can see. Also, more you can see in my Instagram with the same name like Dubai Dentist Dr. Samila. Kindly visit it, and you will enjoy. I'm trying to post daily, but it depends like on our schedule. So about dental phobia. I'm from that country, like from Ukraine, whereas we had private dentistry and like government dentistry. And actually, I don't know because of what, because of maybe low salary there, or because of what. Some doctors they were very rude with some patients before. And when I was small, I had a tooth pain, and me and my mother we went to dentist, and she was already looks like experienced lady. She was around maybe 6 years old, and I needed feeding, but my teeth actually since childhood was very sensitive, and I'm also was the kind of child who is a little bit sensitive. I'm not afraid of like injections, like when they do some vaccinations or something. So for me it was normal, but I was afraid of dentists because I don't like that the way how she talk, and so she seated me in the chair and I had pain in my tooth. And then she told me, okay, you have cavity, we have to drill it. I agreed, but I asked, can we make like some anesthesia or something? She told me to my mother, no, no, no. Why is she asking anesthesia? Like this is only milk teeth. She will not feel anything. So I feel each single movement of your drilling machine. And after that, I just start develop this dental phobia. And I told my mother I will not come back anymore, like to dentist. But thank God, yes, I have good teeth because of my my father. So I have his teeth, and I don't have like that much problems with my teeth. But still, I needed when I needed to visit dentist, I always refused to go there. And until that moment when I developed severe pain in one of it, I said no, feeling again, I don't want. And I refused. At the night, it was around 3 a.m. I woke up from severe pain, and no any medicine was helpful. Probably it was periodontitis, or I don't know, something very serious, because it was too much inflammation in my gum and everywhere, because it was severe process which started long time back. It was chronic problem because I always refused to visit the dentist. And we went that night. It was a doctor on call, and he proposed me two options: like you wait till the morning and you continue your medicine, but I see it's not helpful. So for me, I can only extract because I'm surgeon. And really, he proposed these two options, and then we decided that we'll remove these tooth. Actually, this was uh, second premolar. We removed the tooth, and everything was fine until I was 16. When I was 16 years old, all my bite already was proper, and already when I was 18, all my wisdom teeth was on the place. Everything was fine. But suddenly, after wisdom teeth, this tooth, which was removed early, which was milk tooth, permanent tooth start grow from the palatal side, and my bite become shifted, and I had these gaps. So really, it's very important to find a good physician and trust him, and try to fight this dental phobia, because in future it can cause a lot of issues with your teeth and bite. But thanks God, now we have modern dentistry, and thanks to my colleague Dr. Ahmad, he fixed this issue which I suffered long time back. So it started from dental phobia, and I finished with gaps between my teeth, crowded teeth, lower teeth. So I really very thankful to my colleague, and I really appreciate his work, and he fixed this problem, because I always feel shy about that. So this is my experience, what I think about bad dental experience when a doctor uh, not not supportive, not understanding, and just have cold blood. So then you will start develop dental phobia. Yeah, I see in the chat message, Raikot. Hey, I was going to say something really interesting, but I forgot when I saw you. Thank you so much. Thank you so much for your compliment. But let me ask me this question. Let me answer on your question. Just like try to remember your question and ask. Really, it will be interesting to hear from you. Like, or tell please your bad dental experience. Like, what I think, what makes you nervous about the dentist. Because for me it's helpful, so maybe I will improve my services, what I can do for my patients to fight this dental phobia, because I'm like modern dentist, also I'm supportive and understanding. I'm not judging dentists, because we have sometimes judging dentists. Me and my colleague, we're not judging, so we're not judge you. Feel free to visit us. We have complimentary consultations. Yeah. So for me, really, like I'm trying to be supportive and everything, but still, I have maybe once per month, two, three patients with dental phobia, and it is young patients, not generation like 90s like me, when dentistry was very scary. So really, nowadays, I believe they have everything to provide best and modern and painless service, but still we have patients with dental phobia. Other better. So this like introduction, first series of our morning program, morning with dentist. So maybe next time you will have more time to prepare your questions. You will not feel like shy. Maybe someone of you is shy. I don't know. Maybe someone of you uh, currently don't have any questions, but later on, if you have any questions, also you can message me. You can visit my Instagram. There is a link. You can follow the link. My WhatsApp. So in my WhatsApp, there is a link to a catalog. You can check our prices, our services which providing, and also you can leave a message. You can actually also we do online consultations. You can send your pictures, and we can check your smile, and we can try to do consultation for you online. But I'm advising to visit you for you to visit us. We are staying in Jumeirah, our clinic in Jumeirah, Jumeirah One, Century Plaza. Tinkermoon Polyclinic. Me and my colleague Dr. Ahmad will be very happy to see you. Both of us were cosmetic dentists. We're providing almost all services. For implants, we have implantologists, professional implantologists in our clinic, and we have also orthodontists. And also, recently we visited very nice conference course for aligners. It's a new generation aligners. You can see on Instagram some video about that aligner. It's called Genova aligner. Genova. It's Spanish quality and contains not only like it's not like Invisalign, so it's not transparent tray. It contains also inside a wire. It's more advanced and it can decrease in triple times your treatment treatment time. So and you can achieve best result faster. Mr. Vakas, hello. How are you? How are you? Good morning. Nice to see you. Guys, let's engage in the chat. Let's talk about dentistry. Ask me some questions. I want your questions, actually. I want your questions. I'm not prepared to answer on your questions, but let's figure out and let's answer together on your questions. I will try to answer on each single question which you ask. Try to find even difficult question. It will be more challenging for me. Tell me, guys, how how dentists can change your mind to proceed treatment with him? Like how you can like stop trust to your dentist? Like if you, for example, visit a consultation, and what dentist should do, you will not proceed treatment with him or with her. More people is joining. Maybe Sunday will make a little bit later than 10 a.m. Okay, guys, let's move to another segment. So today it will be just introduction part of our morning show, but next time we'll maybe extend even. It will be more than 1 hour if we'll have more questions. So today just introduction. we're introducing each other and we're just getting know better each other. So I understand. But next time I will wait for you, like from you, questions, and also more engagement. Oh, Mr. Shah wrote, an apple a day keeps the doctor away. Yeah, an apple a day keeps the doctor away, but nice quote, I like it. But still, like some people I know who is trying to stick to healthy lifestyle may not be helpful that much. But it's good quote, I like it. I like it. Apples is very good, especially green apples. It contains more iron, and actually iron very healthy for our gums because I see a lot of patients for cleaning and they have a lot of problem with their gums and some of them losing their teeth due to this issue. Yeah, and also iron it's like there is special tests you can take tests on iron test and ferritin tests, so it's not that much expensive. I'm advising you to do it each 6 months, which I'm personally doing. And vitamin D also very important, especially who is living in countries where you just working and going home and mostly you're using your car, not walking under the sun too much. So probably low vitamin D we have. Let me check messages in chat. People start to become more active. Where you from, Mr. Babu? Uh, I'm from Ukraine, but I'm working and living in UAE for 8 years. So in general, I have 12 years of experience. I'm from Ukraine. So let's move to another segment, which is myth and facts. Jerry, hello, good morning. Good morning. Good morning, dear. Thanks for joining us. So dental myths and facts. I'm going to say a common dental belief, and you will tell me it's a myth or fact. Oh, Mr. Shah, artificially few things who danger for teeth. Artificially few things danger for. You mean like what is dangerous for teeth, right? So harmful for teeth, bad habits, smoking, drinking alcohol, grinding habits. Like some people who's stressed, who has not proper diet, they have grinding habit. It's very dangerous for teeth. I see a lot of patients with such problem. Like in some areas, or I had one patient, her teeth was so grinded, it was so short, and she wanted to make Hollywood smile, like veneers. It was not possible. So it required more complex treatment before a Hollywood smile. And regarding also um, drinks, like if you're I had one patient actually just recently. He's maintaining healthy lifestyle. He's a runner, professional runner, and he liked to drink daily smoothies, and like it sounds very healthy, right? But these smoothies contained oranges and lemon. He liked too much citrus smoothies. Citrus, it was mixed with something, but it was mostly, as he told me, like 75% inside the smoothie. It was orange because he wants some like vitamin C or something, he told me. And he had a lot of erosions in his teeth. And he asked to do fillings. But problem, all his teeth was so damaged. If you do fillings, it will not be looking good aesthetically because fillings tend to become stained. And this is area like which is very important. Like it's like very this area always we can see first before someone will talk to us. So he did before some feelings, and I can know that for him it not works. So I recommend him to do Hollywood Smile. And we did Hollywood Smile, and he stopped to drink too much high acidity smoothies. He shifted to, as he told me, to avocado and banana. Actually, avocado and banana are very healthy smoothies. I recommend. And for citrus, if you're drinking such smoothies, brush your teeth later. Not directly, because after food, recommended to brush your teeth within 30 minutes, because this is better for enamel. Let me check other, because I can't go deep in such subject because it's long. Maybe we make separate life for bad habits, how it affects our teeth, and what is dangerous for teeth. Actually, also one more thing, what I remember. I saw some patients who's using chewing tobacco. Problem that it's not only stain your teeth in orange color, but also it can cause oral cancer. And I saw one patient with oral cancer after chewing tobacco. And it was a very sad story, but this story finished very well. So he was referred to a professional dental surgeon, maxillofacial surgeon, and they did for him treatment. And now this person, he is fine, but good that we found it in early stage, because he noticed something. He told me, "Doc, can you check? I have something on my here buccal side of the cheek." And unfortunately, it was early stage of the cancer. But thanks God, story finished good. And this person, I met him after. He came for follow-ups. He is healthy now, and he stopped this bad habit. So please, guys, don't do these things. It's very harmful. It's harmful more than cigarettes and more than drinking this chewing tobacco. It's very harmful, very harmful. Let me check messages in chat, because I saw there is more messages was in the chat. Oh, Mr. Shah, you're active today. I like. Thank you. Stress also. Yes, yes, correct. Stress. Why? Because stress, people who has more stress, they have more tension here, and they grind in their teeth. For such things, we're recommending to wear night guards, which is easy to do. We just do scanning of your upper jaw. We're sending to lab. Next appointment next day. You're coming. Just pick up this protection cap, and that's it. You will wear it at night, or sometimes some patients advisable for them to wear during the day when they're stressed. Yeah, stress, it's like a cancer, really, also, because if we don't have good mental health, all our general health will be affected. Not only teeth, all diseases from the nerves. Thank you so much, Mr. Shah. Also, thank you. He commented, "Thank you, dear doctor and sister. Thank you so much, brother. Thank you. Thank you for supporting our country. Thank you. Thank you." So let's move to other parts, like dental myth and fact. So I'm going to say a common dental belief. You tell me it's a myth or fact. Whitening toothpaste can fully remove deep stains. What do you think? It's true or not? Like whitening toothpaste can fully remove deep stains. Write something, guys. What do you think about whitening toothpaste? It can remove fully stains, or it's just a temporary effect, or it will remove just partially? Yeah, Mr. Shah, my condolences, really. But let's stay cool. Let's stay. like positive, everything will be fine. And yeah, I know a lot of sad stories, and I'm sorry for your loss. So let's continue. Whitening toothpaste in my as I use them. So why? Because whitening toothpaste it contains big particles, more abrasive inside this paste. So how it's whiten your teeth? It's not whiten your, because we have like layers in the in the tooth, right? It's like enamel layer, dentin layer, and other layer like cement, and where is the pulp and nerves. But this layer, which affected by toothpaste, it's only enamel layer. But enamel, it's translucent. It don't have any color. We have yellowish discolor from dentin layer, next layer after enamel. So professional whitening, which we do in the chair, dental chair, is whiten this dentin layer. At home, toothpaste only affecting enamel layer. So this paste works by just polishing your enamel. So then you have this effect of polished and little bit lighter teeth. But it's very rough, and especially with patients with veneers. Also, I'm not advising to use with high abrasive particles toothpaste because, yeah, veneers it's very strong material, ceramics, but still, we have very nice cold in Ukraine and like Russian-speaking countries. Like water, it will like grind stone. So even water, if you see sometimes in the nature, you see there is a stone and there is a water coming for many years. You see there is depression inside the stone. So nobody knows how it will affect in future your veneers and teeth also as well. And this paste is just polishing this upper layer, enamel layer. And after you drink something or eat something, it will stain it more because like face also, like we have pores in our face. When we wash our face, we do scrub, we do everything. It's clean, our pores is open, like hydrofacial we do. And then we go somewhere and there is pollution and there is like we're sweating and see at your pores how blocked it become. Like so same story with like these rough particles which is inside the toothpaste. So I recommend to use for you professional whitening, to visit your dentist and make professional whitening. I'll tell you briefly about our whitening. We have advanced whitening from Italy. It's better than Zoom. For me personally, before placing veneers, I tried. For me, why I placed veneers, I will tell later story and I will tell like why it's better than whitening. But let's talk about whitening. Maybe some people just want whitening. So professional dental whitening we have. It's only 10 minutes. We need just to prepare your teeth to clean it, little bit to clean surface for better absorption of this whitening material. It's around maybe 15 minutes it will take. And then we need to retract your gums to protect your gums. And then we apply this special liquid gel from the syringe, which is mixed under pressure. And then we apply in each tooth and we're putting under lamp for 10 minutes only. And you will get instant result. Same result as you can achieve with the Zoom, like 2-3 sessions. We have very nice system. If you're interested, directly message me and I will book for your appointment. We can make it a complimentary consultation first, and if you want to proceed, we'll proceed with this whitening. And we have actually a very nice promo, 349 dirham only, 349 along with cleaning, inclusive inside this package. This company from Italy, and I used many years before, around 3 years I used, and then we had also presentation from the owner of this Italian company. Actually, the name of this company Blank One, and they have different. They had before like original, and now they're providing this Ultra. So now in our clinic we're providing this advanced whitening system Ultra. And for maintaining, we have also another system like opalescence. It's very nice. We are doing for you trays in the clinic. You'll pick up this whitening trays and we'll provide you with syringes of opalescence gel to maintain your result. So it's better than whitening toothpaste. Use just regular toothpaste with fluoride, which contains fluoride inside. This is the best option. Regarding brands, I can mention later. Actually, I'm planning to make separate video about this. I will make video and I will post here and on my Instagram. Uh, let's check message in the chat. Thank you so much. Thank you so much. Thank you so much. So let's move to another question and another part of this section, myth or fact. Chewing sugar-free gums, it helps prevent cavities or no? What do you think, guys? This regular like Dirol or I don't know what the name of this brands, any brand of chewing gum which is written like sugar-free, contain xylitol or like this one, these chewing gums which we are buying from the groceries. Like, you think it will protect your teeth from the cavities? Yes or no? Just type something like Y or N. For me, it will be very interesting, really. Oh, I like your participation, Mr. Shah. Really, I like your participation. He is very active in the chat, really. No, uh-huh. Okay. Who else? Who think it can protect? It can prevent? Oh, that's nice. We have from different countries people. Yeah, Tunis. Tunis, very beautiful country. I like it. I like actually all Arabic countries. It's very nice, and also each country is nice. And I know a lot of good people from Tunis. I know good people from like Jordan. I know good people from Syria, and actually most of my colleagues now from Syria. And I like too much how these people, and I like also UAE people, like local people. Really, they're so nice. Like, like Middle Eastern culture, it's different, completely different from our culture. Like, our people sometimes not smiling, very angry in the morning. Middle Eastern culture is completely different, and I'm enjoying. I like it. That's why my choice. I'm living in the country where, like, you feel safe. Like you can walk in the evening, and nobody will say you something. Like, it's very safe and it's very good and modern, and like I like Middle Eastern. Pakistan also. Pakistan, your strongest people actually. Each country has its own value. Like Pakistan, you're very strong people. Actually, if I will like judge as a doctor, my patients, like Pakistani people is very strong. I remember one Pakistani patient. He came with his family, and he had surgical extraction. At that moment, also we had a lot of patients, and one patient just had filling, and we finished with filling, and then Pakistani guy came and he needed extraction of his tooth, and it was surgical extraction. He sit like calm all procedure. It was surgical extraction with incision of the gum and removal root by root, wisdom tooth, upper wisdom tooth, and it was so impacted. And he just stand up, and like nothing we did for him, like he just nothing. He was very strong also guy. And then once we had follow up after 7 days, I put sutures for him because it was also incision on his gums, so we need to suture it for better healing. And he's supposed to come after 7 days for follow up to remove the sutures because I did non-removal. We have removable, which is a non-removal, which is absorbent. And he came, and everything was healed. Like, he came only after 3 or 4 days, as I remember. Really, it was healed. I can't even locate where we extracted those tooth. Can you imagine? Really strongest, I believe, people for healing process. I don't know for other like procedures, but really, it was like wow. Yeah, so I will answer the question regarding chewing gums. Chewing gum, it can prevent cavities because it's sugar free, and also when we have some food inside, like during the work, nobody's brushing teeth. Only when sometimes we are visiting restroom, maybe we can brush. But in between meals, sometimes we don't have that much time, and we will not floss. We are flossing only like when we reach home, or sometimes if something stuck really we have in our bag. But usually, we not floss like each second after we eat cookie of cavities, and also it's sugar free, so it not contains sugar. Uh, Next session. You should brush your teeth right away after drinking coffee. So you drink coffee, like me now, and then you need to brush right away. So I should have now in my bag brush, and I should brush directly. What do you think? Is it true or no? Actually, I just informed you about brushing teeth after food. After how many minutes we should brush our teeth? Directly, or who remember? Who remember? After how many minutes we should brush our teeth? Directly or after some time? I'll tell you answer. It's a myth. You have to wait 30 minutes before brushing. So after food, not advisable to brush directly your teeth. Whether it's coffee or any kind of food, you have to wait for enamel to adjust to this, because when you're eating your food, your enamel become little bit weaker, as per some research. So you have to wait and then you can brush. So now we'll move to another section, story time with the dentist. So let me tell you about one of my recent cases. Uh, I have a lot actually. It will take more than 1 hour, and today I believe session more than 1 hour already. But I will tell you like briefly one interesting case. So yeah, uh, I had one patient, very interesting case. She's young. She had old crowns. Her gums stained because of metal ceramic crowns. It was not like zirconia crowns. Zirconia crowns is better because it not contains metal inside, so it will not stain your gums after some time. And aesthetically, it's more good. It's more aesthetically good looking, and also properly fit to your gums. So you will not have these gaps between your gums and where his food always will stuck. So she had this problem with gums, and it was 2 crowns. Maybe you can see a case in my Instagram also. It's already posted. She's my very old patient, and she was searching for me for around 7 years. When I worked in my first clinic, and we lost contact because in previous clinic they told that doctor on vacation, because they want to like to treat her and to make for her veneers, but she refused, and she told like later I will do. And she told me maybe it was sign from the God, because I had a lot of promotions, a lot of options to fix my teeth, but like maybe it's sign from the God. So this is was the smile which meant to be. So she had this problem with her gums, stained gums, crowns, and crowns was overlapped teeth on each other. It was protruded, and also some of teeth not aligned, so also not straight. It was overlapped, and also lower teeth. and she had one missing tooth here, premolar. So we did for her bridge. We changed these crowns. We did veneers. This was one of the challenging cases for me, and yeah, it was very interesting case, but we achieved good result. Veneers. So this was very interesting case, and me and my colleagues sometimes we like to help each other to fix the case. Sometimes really we are enjoying such challenging cases, and yeah, it was very challenging for us this case, and it was very nice result. Another patient which I had this week, she want natural veneers. Natural veneers. She chose the shade bleach 3. But our lab not followed our instructions sometimes because we have AI powered this technology and this smile design computer. So it chose bleach 2 for her. So when she came, I offered her to try it, and she liked actually the shade, and she told me really good that this program, Digital Smile Design, choose for me bleach 2. So now I will not regret because really I like this shade. So this now we are come back to this story. Would you trust AI or this digital application to choose for you smile? So this was very nice, and because also for me I was very tense. I don't know how she will react, but actually, if you want darker teeth, you can always make it darker. You can adjust, like during try-in, you can request from your lab to make it darker, but you can't make it lighter from the dark shade. So yeah, and she liked this case. It was very nice, and also was not easy case because it was almost non-prep. She had very small teeth. Later, she will come back for follow-up, and I will film for you some videos because she is a model for me. I informed her like this case is very interesting for me, so we'll do some testimonials, also some videos. We'll show you how it was before and which result we achieved. Actually, we have different labs. We are working with 2 labs. One lab which is doing super natural teeth and premium veneers, which is super natural. All our veneers premium, but we are calling it like actually let's come back to this like 3D, 6D, premium, VIP, Lumineer, 6D near, any name, or maybe Samilaneer. Maybe I should also name it. So these all brand names. So premium were called like this maximum natural. 3D smile, 6D smile is translucency. Depends on the like how much time technician should spend on your work and which artistic view he has. So we have one lab with natural view, like artistic view. We have another lab who is doing veneers, which is looks translucency, artistic touch, but it's visible that it's veneers. So like I fixed for myself, I like this one. This one, best-selling veneers. Natural veneers, it contains more natural shades, like it can be like A1, A2 shade, like these shades, not bleach shades. So this one, much like natural. So we have lab for such inquiries, and we have lab who want Hollywood smile, like I have, like my colleague Dr. Ahmad fixed for me. I like too much because I don't like when it's each tooth separately. I don't like. I like this style of veneers, which is look like Hollywood smile, not natural like shape. Because I feel more confident with the shade, and I like it so much. Shade we have from bleach 1 to bleach 4. But best selling like mine, it's bleach 2 shade. It cost 399. Now we have offer. Regular price is around 6,000, I believe. And another type we have 6D, like I have 6D, 6D bleach 2. Our regular price for these veneers 8,999, but now we have offer 4,999. This price, please note, for 20 teeth. So full case, like when you smile from premolar till premolar. And we have premium this premium smile. We name it premium smile. Also, it will be like Hollywood smile. It costs 11,999 and can be done with natural shade. like natural shade. And also it can be done with bleach shades, but with we're using for natural smile, we're using feldspathic material. Feldspathic material is like in Russian feldspatный material. Это feldspatный, we call it like feldspat. It's another type of material which is using for achieve more natural smile, like natural shades we are using. It's like, but for general, for all 6D, 3D, for premium smile, we are using Emax. This is from Germany, Eva Klar. It's very strong material, very strong material. It's very hard to break. And actually, we're providing warranty. Depends on the choice of your veneers, like from 5 years to 10 years, along with 2 complementary cleanings. So first cleaning will be during fixation of your veneers, and second cleaning you have on balance within 1 year. So full support from us. If you're interested, book your consultation. It will be complimentary. We'll do for you complimentary smile design. You will see your future smile. And also, we can just talk, discuss more, and we can give you shade guide. You can choose which shade you want, and this program will make for you this demo. Again, I'm repeating that we are located in Dubai, Jumeirah 1, Century Plaza, Tinker Moon Polyclinic. Probably the best clinic in Dubai. Actually, because we are always updating our knowledge, always updating our equipment. We are very active on social media, and we have like highly skilled doctors. Yeah, because our experience 10 years, 12 years. So we have knowledge, and we are specifically qualified for cosmetic procedures like veneers, bridges, crowns, and along with other treatments also. Yeah. So regarding cases, I have a lot. So I will try to make separate maybe videos or posts. So later I will post. We'll have today follow up for veneers, and we'll have also another follow up for veneers soon. And I will try to post it. I will try to post it soon. It's mentioned that live will finish in 4 minutes, so we have to wrap up for today. But really, it was very nice to see you all, and it's very good engagement that at least you're commented something, and it's like you're joining. I really appreciate your valuable time, which you can spend along with your family, but you're spending it with me. I really appreciate it. And so let's wrap up the show. Show must go on, but let's wrap the show for today. So we talked today about crazy dental tech, AI, robotic dentists, and real patient stories. So the future of dentistry really is looking amazing. It's looking amazing. In closest future, actually, you know this news. What about Japan? They developed some like medicine or something. I need to do research about this, and we'll discuss next time. But I briefly I hear about this story. They developed some solution which is blocking our genes for a third set of new teeth. So people who don't have teeth, who have dentures or implants nowadays, soon by 2030, you can grow your own teeth. And some I know some doctors I read in comments in that news wrote like, oh, now we'll stay without work because each person can buy it like as a candy from the pharmacy. No, it's not like that. Why? Because it will be same as our teeth, right? So if you have not straight teeth, for sure you'll need to put braces on it. If you have gaps between teeth, also we'll need cosmetic dentists. So it's still fine. We still will have some work. So dentists, don't worry, and patients, this is amazing news for you and for each of us, so we can grow our teeth soon. This is very nice. Yeah. Then, if you are enjoyed today live, tap the heart, like my live video, and follow me for more. Subscribe for notifications so you'll not miss any live. And I'll go live. I'm planning to go live 2-3 times per week, and I will inform you a day before. And I will come with new topics. And also, if you have any questions, send me please. So I will prepare. I will prepare answer on it, and it will be very nice. So we'll have more topics to discuss. So direct message me or drop in the comments what topic you'd love me to cover next. So also I will prepare it because today I'm not prepared at all. Why? Because this is like first introduction session. I want just to meet you, to see and to ask you how are you, just to see your engagement. Engagement is good, but next time I would like to see more people engaging in our life. Okay. So thank you so much for spending our morning like together, and really appreciate your time. And really, it's like for me, I value each of you, and we'll become now friends. And take care of your smile. And I'll see you next time on the breakfast with the dentist. Okay, bye bye, and see you again. Probably maybe it will be Tuesday or Wednesday, because Thursday I have one very nice collaboration, and later I will post it and you will see which collaboration I had on Thursday. Have a nice week ahead, and love you all. Bye bye.